Yes.
We were one of the first practices in the country, the entire United States.
Your office.
My practice.
Your practice.
Was
Yeah.
one of the first in the United States to attest to meaningful use. Meaningful use is the federal government's program using electronic records meaningfully.
Mm-hmm.
When we were ready to attest that we could use an electronic record meaningfully, our vendor, the people who managed our software, weren't ready. We had to wait a few days till they got ready for us. I started using electronic records in 2005. I did that not because I wanted to be first, but I am obsessive and compulsive. I wanted to have the best medical record that I could possibly have, because that's part of my responsibility, not just to see the patient, but to create a record that's legible and reflects the care of the patient, and something that could be interoperable, something that other practitioners could use to help in managing the patient's care. So when we started, the question was, well, did that come between me and the patient? Of course it did. Anything you bring into the consultation room, into the exam room, is likely to come between you and the patient. But it's a tool. You know, my stethoscope comes between me and the patient, but it's a tool. I use it. The electronic record comes between me and the patient, but I use it. It's a tool. So, of course, you know, when I should have been taking typing in high school, I was there doing shop, figuring out how to build silly things. I should have been taking typing. Well, I didn't, so I'm suffering today. So I can't type fast. I can click, but I still can't click fast. So, of course, it takes me time to do the record. But, you know, that's just, you know, an element of what I do. You know, my mother started painting at 60. I could certainly learn to use a computer at 40 or whenever it was that I started. So, you know, we are we're on the forefront of this. We just attested to the the second stage of meaningful use. We're in the process of becoming a patient-centered medical home. We do PQRS. These are all government programs that encourage physicians to digitalize the record.
Mm-hmm.
We stopped having paper charts. We got rid of our paper charts from 2007. So, you know, I haven't seen a paper chart. We now use the file room as an examination room area. So, yeah, we got rid of that. But, you know, there's certain things that one had to learn. For example, in the beginning, I would look at the patient and I would say straight to their face, listen, I'm new at this. I'm going to be looking at this screen an enormous, you know, for a long time sometimes. Just bear with me. What do you think the patients did when I'm on my screen? They would whip out their cell phone and they would do their stuff. And when I was ready to come back, they would stop and they would come back. So, you know, you sort of work it out. You negotiate. And that's what I think physicians have to do with patients all the time. We have to negotiate that therapeutic environment. We have to negotiate the care. Those electronic records I was telling you about, the meticulous nature of keeping records, knowing exactly what's going on with the patient, knowing how many medicines they're on, knowing which ones were stopped, knowing what doses each ones are on. It's a lot of work to keep track of all of these things, and electronic records helps that, and a careful physician will keep track of that.